Gentlemen, let me ask you a question most men are too embarrassed to say out loud. Have you ever been close to your partner, trying your best to make her feel wanted, desired, and fully aroused, but something still felt missing? Maybe she was present, but not fully responding. Maybe you were doing everything you thought was right, but her body was not warming up the way you expected. Maybe you started wondering, am I doing something wrong? Is she no longer attracted to me? Has age changed everything between us? Or was I never really taught what women actually need? If that question has ever crossed your mind, you are not alone. Many men, especially after 50 and 60, quietly struggle with this. They still love their partner. They still want closeness. They still want to give pleasure. But they were taught the wrong map. And when a man uses the wrong map, even with good intentions, he can miss the very thing her body is asking for. I'm Melissa Carter, a medical researcher focused on men's health, aging, hormones, intimacy, and the science of connection. And today I'm going to show you something most men were never properly taught. Why so much foreplay fails. The 4 mistakes that quietly shut down female arousal. And the one approach that helps many women feel safer, more connected, and more physically responsive. But stay with me, because mistake number 3 is the one that looks romantic on the outside, yet often kills the spark without the man realizing it. Before we begin, subscribe for honest men's health conversations most people are too uncomfortable to have, and tell me in the comments, where are you watching from? Now let's start with the truth most men never hear. Foreplay is not a trick. It is not one magic move. It is not a secret button. And it is not about rushing her body toward your goal. For many women, arousal begins long before the most intimate touch. It begins in the nervous system. It begins with emotional safety. It begins with feeling wanted, not pressured. It begins with feeling that you are present, not performing. It begins with her body believing, I can relax here. That is the part many men miss. A woman's body often does not respond best to direct intensity right away. It responds to gradual awakening. Her brain, skin, breath, muscles, emotions, and trust all play a role. So if you jump too quickly to the most obvious places, you may think you are increasing pleasure, but her body may experience it as pressure. And pressure is one of the fastest ways to slow arousal down. Now let's look at the 4 mistakes men often make without realizing it. Mistake number 1, going too direct too soon. Many men think the most intimate areas should be the starting point. They assume, if this is the most sensitive area, I should focus there first. But that is often backwards. Before a woman is fully aroused, direct stimulation can feel too intense, too soon, uncomfortable, or emotionally disconnected. Her body may not be ready yet. Think of it like turning on a bright light in a dark room. The light may be useful later, but if you switch it on too suddenly, the body pulls back. Arousal needs a gradual build. Her nervous system needs time to shift from daily stress into openness. So instead of beginning with intensity, begin with presence. Slow down. Let her feel your attention. Let her feel that there is no rush. Let her body catch up to the moment. Because when you skip the warm-up, you are not saving time. You are often making arousal harder. And that leads to the second mistake. One many men make because they are trying to be gentle. Mistake number 2, touching without intention. Some men go too direct. Other men go too vague. They use random light touching, soft strokes, or repetitive movements and hope it creates desire. The intention may be loving, but the body may not read it that way. Touch that is too faint can feel ticklish. Touch that is too random can feel distracting. Touch that is too repetitive can feel mechanical. Touch that is too hesitant can make her feel like you are unsure of yourself. For many women, arousing touch is not about being aggressive, it is about being intentional. There is a difference between touching her body and paying attention to her body. She can feel the difference. Intentional touch says, I am here. I am paying attention. I am not rushing. I want all of you, not just one part of you. That emotional message changes how the body receives the physical sensation. So the fix is simple. Slow your hands down. Use confident but gentle contact. Notice her breathing. Notice where she softens. Notice where she tenses. Respond instead of repeating. And now we come to mistake number 3, the one that seems romantic but often sends her body in the wrong direction. Mistake number 3, turning foreplay into a massage session. Now, massage can be wonderful. It can relax her. It can reduce stress. It can help her feel cared for. But relaxation and arousal are not always the same thing. A long, slow massage can sometimes move her body into a sleepy, passive, spa-like state instead of a sensual, emotionally engaged state. She may feel comfortable, but not necessarily turned on. That is why some men say, "I spent 20 minutes massaging her and nothing happened." Because massage can prepare the ground, but it does not always create the spark. The key is not to remove massage completely. The key is to blend relaxation with emotional presence and sensual rhythm. Do not let the moment become clinical. Do not make it feel like a service. Do not disappear into technique. Stay connected. Arousal grows when relaxation and desire meet. If there is only relaxation, she may drift away. If there is only desire, she may feel pressured. The art is in combining both. And now let's talk about the 4th mistake, the one many men use when they are trying to be exciting. Mistake number 4, staying too much in her head. Words matter, flirting can matter, compliments can matter, emotional teasing can matter, playful conversation can matter. But if everything stays mental, she may never fully arrive in her body. Many women already spend much of the day thinking, planning, worrying, managing, and carrying responsibilities. If intimacy becomes another mental game, another performance, another conversation to analyze, her body may stay switched off. True arousal is not just thought, it is a physical transition. The body has to feel safe enough to soften. The breath has to change. The muscles have to release. The skin has to become more awake. The nervous system has to move from thinking into feeling. So yes, use words, but do not rely only on words. Your voice should guide her into her body, not keep her trapped in her mind. Now that we have cleared the 4 mistakes, let's talk about what works better. I call it full body presence, not a trick, not a routine, not a checklist. Full body presence means you stop focusing on one isolated area and start creating a complete sensory and emotional experience. You use warmth, breath, closeness, slow contact, eye contact, your hands, your body positioning, your voice, your patience, your ability to read her response. The goal is not to make something happen. The goal is to create the conditions where her body wants to respond. That difference is everything, because many men approach foreplay like a task. Step 1, Step 2, Step 3. Now she should be ready. But a woman's arousal is not a machine. It is more like a fire. If you throw too much on it too fast, you smother it. If you ignore it, it fades. But if you feed it gradually, with attention and patience, it grows. So how do you practice full body presence? Step 1. Slow yourself down first. Before you touch her, check your own nervous system. Are you anxious? Are you rushing? Are you trying to prove something? Are you worried about your own performance? She may feel that. Many women are highly sensitive to emotional pressure during intimacy. If you are tense, she may become tense. If you are distracted, she may disconnect. If you are rushing, her body may resist. So breathe. Relax your shoulders. Slow your pace. Let your attention settle on her, not on the outcome. A calm man creates a safer atmosphere than a desperate man, and safety is where arousal begins. Step 2. Build sensation gradually. Do not start with the most intense touch. Start with closeness. Let her feel warmth. Let her feel your attention. Let the contact build slowly. Move through the body in a way that feels natural and responsive. The neck, shoulders, back, waist, hips, thighs, hands, and face can all become part of the experience. Not because every area is equally sexual, but because the nervous system receives arousal through the whole body. The more her body feels included, the less she feels reduced to one part. That is powerful. Because emotionally, full body attention says, I want you, not just access to you. And that message can change everything. Step 3. Vary rhythm and pressure. Arousal often fades when touch becomes predictable. If your rhythm never changes, her nervous system may stop paying attention. So vary the experience gently, sometimes slower, sometimes firmer, sometimes stillness, sometimes movement, sometimes closeness, sometimes space. But do not become theatrical. This is not about performing a routine. It is about responding. Watch her breath. Listen to her sounds. Notice her body language. Notice when she relaxes into you. Notice when she pulls away. Her body is giving feedback. Your job is to listen. And this is where many men over 50 can actually become better lovers than they were when they were younger. Because younger men often rush, mature men can learn presence. Step 4. Let desire build before intensity. This is where patience becomes powerful. Many men move to intensity the moment they notice a positive response. But sometimes the best thing you can do is not rush toward the next step. Stay with what is working. Let her body deepen into the moment. Let desire build. If she is responding, do not immediately change everything. Arousal often needs continuity. When you constantly switch techniques, her body has to keep restarting. So think less like a man trying to unlock a code, and more like a man tending a flame. Step 5. Personalize everything. There is no universal script that works for every woman every time. Some women respond to slow tenderness. Some respond to playful energy. Some respond to emotional closeness. Some respond to confidence and directness after they already feel safe. Some need more time because of stress, menopause, pain, medication, or body image concerns. This is why communication matters. Not awkward interrogation, not asking every 10 seconds, "Is this okay?" But gentle, mature communication. You can say, "I want to understand what feels good for you. I do not want to rush you. I like when you show me what you enjoy." We can slow down. That kind of communication does not weaken the moment. It often makes it safer, and safety makes response easier. Now, let me speak directly to the men watching who are over 50 or 60. If intimacy has changed in your relationship, do not immediately assume passion is gone. Often, the problem is not lack of love. It is pressure, routine, stress, hormonal changes, health changes, unspoken resentment, fear of rejection, or years of both partners pretending they do not need to talk about it. But silence does not protect intimacy. It slowly drains it. Your partner's body may need more time now. She may need more emotional warmth. She may need help with discomfort or dryness. She may need reassurance. She may need to feel desired in a way that is not rushed or goal-focused. And you may need reassurance too. You may be worried about erections, stamina, timing, or whether you still have what it takes. But here is the truth. Real intimacy after 50 is not about acting 25 again. It is about becoming more attentive, more patient, more emotionally present, and more honest. That is not a downgrade. That is maturity. And for many couples, it can become the beginning of a deeper intimate life. Now, a medical note. If your partner experiences pain, burning, bleeding, severe dryness, pelvic discomfort, or loss of desire that feels distressing, she should speak with a qualified healthcare professional. These issues are common, especially after menopause, and many can be helped. And if you are experiencing erection problems, low desire, fatigue, blood pressure problems, diabetes, low testosterone symptoms, or performance anxiety, you should also get evaluated. Intimacy is not separate from health. It is often a reflection of health. So let's bring this together. The foreplay that helps many women respond is not one move. It is full body presence. It means you do not rush. You do not go direct too soon. You do not touch randomly. You do not turn the moment into a massage appointment. You do not keep her trapped in her head. Instead, you create safety. You build sensation gradually. You use intentional touch. You pay attention to her whole body. You respond to her signals. You let arousal build instead of forcing it. That is how you stop performing and start connecting. And gentlemen, remember this. A woman's body does not open because you found the perfect trick. It opens more easily when she feels safe, wanted, respected, and unrushed. That is the part most men were never taught. But once you understand it, everything changes. This is Melissa Carter. If this video helped you see intimacy differently, subscribe for more honest men's health conversations, and tell me in the comments, which mistake do you think most men make without realizing it? Because the more openly men talk about these things, the more relationships we can help heal. And remember, passion after 50 is not gone. It is just asking for a different kind of attention.